عمرها 4 سنوات، سقوط من علو. عندها
4 years old. She was fallen down 2 days ago.
عندها إصابة شديدة بالرأس.
She has a fracture in her head.
multiple skull fracture. في عندها نزيف داخلي.
She has internal bleeding.
هين بدأ اوكي. وتحت جهاز التنفس الصناعي.
Erez crossing is a sort of unknown fortress. Your permit is not necessarily given to you. It's not a guarantee that you'll get through the crossing. Gaza, due to the legacy of de-development of the medical system, has always been dependent on referrals and references to external medical care. Around 1,000 patients each month who need to get out of Gaza for medical care, who need referrals. And in fact, the number of people who get out today is around half of that number.
The complexity of the referrals abroad is starting from the very beginning in actually getting an appropriate diagnosis. And we have a lack of specialists in Gaza. And those specialists that are there are often compromised by what they're able to do because they don't have the machinery to do it. If a patient needs to have treatment outside, they first have to get a medical referral from a doctor that they cannot be treated inside the Gaza Strip. After that, they need to be able to get a guaranteed place at another health facility, whether that's in Israel, in Jerusalem, or outside in Egypt or Jordan. Only then will the Israelis actually start to process a permit. When the permit does get issued, there's only given with very short notice. Often it's less than 24 hours. And the patient, and imagine a chronically ill patient, has to move quickly to Eretz to clear and to use their permit on the day they've been issued it.
Only if it's life-saving medical care will you be allowed out. If you're in danger of a leg amputation or of losing the eyesight in one of your eyes, that would be considered danger to quality of life and not to life itself. And so then some of them were not even considered for application for permits.
We have cases where we've had a child who needs to go for treatment outside, and it's often the parent who's not being given the permit to travel with the child. And imagine how traumatic that is for a sick child not to be able to travel with their parent that they feel comfortable with, and going through very difficult and sometimes very intrusive operations, surgery and medical follow-up. We can't even imagine this in the UK.
رولا وشاح إبراهيم محمود وشاح بنتي، وجرينا يعني للتنسيق يعني لها تحويل على إسرائيل، يعني وأنا حطيت اسمي كأب لها عشان سني 33 سنة رفضوني.
كيف شعورك إنه أنت غير قادر على إنه أنت تروح معها على المستشفى ترفقها؟
ايش شعور اب يعني يسيب بنته تقلط يعني ولا يسيب ضنايا يعني بشوفوا بحالة خطرة وشي زي هيك يسيبه يعني يعني قد ما كان صحيح انه الست اللي طالعة يعني ستها، بس انه الاب يختلف كليا. هو الرب علم يعني ضنا هذا.
So if you're a patient in Gaza and you have, let's say, breast cancer, and you need chemotherapy, and after that more advanced types of diagnosis that don't exist in Gaza, or radiotherapy that doesn't exist in Gaza, you'll need first of all to get a medical referral. Now, since you're in Gaza and the Hamas authorities are not recognized for this purpose, that means that your request will have to go to Ramallah, to the Ministry of Health, the official Ministry of Health in Ramallah, and only there can they okay your medical referral as well as the financial coverage for your treatment. After that, you can go and ask for a permit. But you're not allowed to go directly to the Israelis to request a permit. You have to request a permit via a Palestinian coordinating mechanism, which then, if you're lucky, transmits your request to the Israelis. And that's where the long wait begins. After one delay begins a longer delay, because often the Israeli bureaucracy simply doesn't answer, delays your replies until you've missed 1, 2, or 3 appointments with your doctor, medical care.
Unconscious patients, sometimes they have to stay for 10 hours time waiting in very bad conditions till the Israeli soldier arrange or accept her entry to the air's crossing.
هو الأفضل كأفضل يعني بتواجه ممكن مخاطر، يتعب المريض، ممكن يقلل نسبة الأكسجين من عملية النقل، ممكن يصير هبوط حاد في الضغط في الدورة الدموية. هذه المخاطر اللي ممكن نواجهها.
We had documented over than 80 Gaza patients who passed away because of the Israeli closure policy. It's a catastrophic situation for the Gaza patients.
A final obstacle, a final problem, which started in 2007 but has become progressively more and more systematic as the months progressed, is the issue of coercion or extortion of patients. What that means is that patients are now being, in many cases, called up to Erez crossing before receiving a response to their request to exit Gaza. They're being called up to Erez crossing and interviewed by the secret police. You're first asked about yourself, about your family, about things that might suggest that you might be a security threat, and then the questions become more general and you're asked about connections in your family, about who might be politically active in your family or in your neighborhood or in the refugee camp that you live in. And in the course of these interviews, you're either given to believe or told explicitly that if you provide this information, you'll be allowed to get out to medical care, and if you don't provide the information or can't, then you'll go back to Gaza.
It's a mass violation to the international humanitarian law based on the Israeli occupation authorities and occupation power to ensure all the access of human rights based on right to access to health services.
In addition, very often the crossing is closed without any explanation, without any kind of warning, either as a result of shooting it towards the crossing or as a result of something completely unconnected and political that has happened in the political spheres way up there and outside your own world, and all of a sudden that means that the gates are closed, and no matter how many times and how long you've spent, months and months sometimes, trying to get finally to your doctor, that's the end of the story, and you can go back home to Gaza and start right from square one all over again. And it must feel for these patients as like a very lethal sort of snakes and ladders game.